right, we're on the street, man. All right, so today we're going to actually be talking about a common issue that a lot of people deal with, and that's actually dental pain. You know, many people face it. Everybody deals with it a little bit different, but I think a lot of times people really equate dentistry with pain. I get it. So I'm going to go ahead and give you guys a quick case presentation. We'll kind of talk about a few things. Hopefully this will help somebody that is struggling with dental pain. So our patient today is actually coming to the office because they're experiencing a toothache. And this is understandably so because their last dental visit was a root canal. And so the patient had actually been avoiding going to the dentist just because, one, they had a root canal last time they came, and then two, root canals are very, very expensive. So you get this a lot. There's a lot of people that struggle with, just hold off and wait until the last minute. Back to the patient. So that visit was actually 4 years ago. And the patient had a abscess the last time. And so they feel like a lot of the symptoms that they're experiencing right now are almost the same as symptoms that they were experiencing the last time that they came to the dentist. So they're very, very nervous and anxious about the tooth being infected and that the treatment being the same. The patient shares that they don't want to pay for a root canal, and I get it. A lot of times we'll see patients that will say, if it's a root canal, I would rather just have it taken out. Now, if the tooth is bombed out, I'll absolutely sign on for this to take the tooth out. But if the tooth has some type of pulpal insult, meaning that there's some decay that has made it to the nerve, but the tooth is relatively sound, I usually try to encourage patients to at least see about getting the root canal. The reason why is this particular patient that we're talking about today is relatively young. And so if we just start snatching teeth out of that person's head, they may be cool with it right now in their 30s, but when they become a lot older, it's highly likely that decision that they made to take all these teeth out, especially teeth that are sound and that are not in as bad of shape as others, I think they'll definitely probably be kicking themselves on the back end. But I want to actually encourage you as well as give you some information on if this is something that you're kind of dealing with too. So I think one of the main things that myself and other counterparts have challenges with is with nervous patients. And I think my approach when it comes to dealing with patients that have anxiety or dental anxiety is to build some level of rapport. Too often as doctors, we typically kind of glaze over a patient's past trauma. And it's really important that everybody understands that trauma is a natural thing.
In 900 feet, turn left on Pembroke.
And I think one of the main things that doctors really need to understand is that trauma really helps to shape the dental visit. So if we just continue to keep scooting this trauma underneath the rug, we don't really touch on it too much. We just kind of mention a few things, give them a couple of common, sayings like, oh, it'll be all right or whatever. But we really don't allow that patient to express themselves in that moment. What you end up seeing is a cyclic type of scenario where patients wait until the last minute. Patients are usually in pain. They have a hot tooth. And it's challenging for the patient because one, they can't be numbed, or it's challenging to get them numb, or two, the patient equates your treatment, or when I'm saying I'm saying the doctor's treatment with pain. And it's not explained that one, preventative is the most important thing, or if you've gotten to past the point to where you can't prevent anything, two, at least allowing that patient to say like, hey, when I was a child, I was having a tooth extracted, the doctor kept going, it was very painful, and it scares me. And I think just allowing the patient to verbally say that out loud will probably take away a lot of the fear and anxiety that patient may be feeling. I think it's important to let the patient know what's really in it for them. So as you're building rapport, you're building them up, you want them to know what's in it for them. We do this by educating the patient and helping them to build confidence in their provider, because we're giving you the information, and then also in themselves understanding that they can take control of their health. Dentistry doesn't always have to be painful. Yes, there's an initial stick when it comes to giving you local anesthetic, but we don't have to wait until the last of the last in order to be seeking out care. And I think that's probably one of the disconnects with our patients as well as with some of our doctors is we're okay with, not explaining or having that tough conversation with that patient to say like, hey, next time we don't want the same outcome. So instead of doing this, let's think about or try to do this. This helps patients to understand what's the best option for them. Giving the patient all the information really helps to build trust, and it also helps the next visit. So for me, if I lay it out and the patient is able to ask the questions, understand what the next steps are, there's no unknown, I'm explaining things. This is going to really help to lower the patient's anxiety. And the patient's going to come or present to the office and they're going to be less nervous. Now, I recognize that I won't be able to erase all the anxiety, but if I could at least bring it down to 50 to 70% of anxiety, whereas you came in at 150, I'm cool with that. And this is really huge because it allows me to really get to work. And that's really why the patient is there, which at the end of the day is going to help everybody in the world. It's going to help the patient because they're going to be comfortable throughout the procedure. It's going to help me because I know that they're not hurting while I'm working on them. And that's going to make me feel good too. If you made it all the way to this point and you haven't subscribed, I would encourage you to do so. I hope this helps. You guys be blessed. Talk to you real soon.